Welcome back to my channel. So today I'm going to make another video for nursing care plan for a patient who came to the emergency department with a fall and is having a subdural hematoma. So we are going to make a care plan for risk of fall. So first of all, we need to write a nursing problem. We'll say Mrs. A is at risk for fall due to history of fall. Our aim of care will be Mrs. A will have no incidents of fall and safety will be maintained throughout the shift. Re-evaluation date would be to be re-evaluated today's date, or if her clinical condition changes. The next thing we need to write is care provided by the nurse. We are going to use the meta-read method. So explain and discuss all aspects of care to Mrs. Joe, to Mrs. A, and gain consent for every intervention. Number 2, monitor and record Mrs. A's neurological observations and escalate as per GCS score. Number 3, assess Mrs. A fall risk and complete a fall risk assessment tool. Number 4, provide Mrs. A safe and clutter-free environment and make sure there are no water spillages or cable wires on the floor. Number 5, administer Mrs. A her prescribed medications and monitor their effectiveness. Number 6, refer Mrs. A to fall risk assessment team if needed. Number 7, instruct Mrs. A the proper use of call bell and place it within her reach. And last but not the least, document all Mrs. A's care as planned. Okay, so these are the nursing care provided by the nurse. We have 8, so you need to write minimum of 5 in the exam, but if you have time you can write 8 also. So self-care activities would be Mrs. A verbalizes understanding of her plan of care and gives consent. Number 2, Mrs. A properly uses the call bell when needing assistance. Number 3, Mrs. A verbalizes understanding of being reoriented to person, time and place. Mrs. A actively participate in her plan of care. So that would be our 4th, self-care activities. So I have given you an overview, but if you have other points you can include, because when I was preparing for Osce, I found it hard to make a care plan. That's why I wanted to share a video with you guys, so just to have an idea about nursing care plan, because most of us, we don't do nursing care plan in our countries, so this is a bit difficult. So make sure you practice it every day. Okay, make some nursing problems and then try to find their solution, like how would you do it in a clinical setting, how would you care for a patient who is coming with this problem. Like, you can just assume the problems and write the nursing care plan based on that, and try practicing, guys. It's hard. Literally in the exam you will not have no idea what you are going to get. So keep practicing and remember me in your prayers. If you have any questions, please don't hesitate to ask me. Thank you so much. God bless you. Take care.